COVID-19 isolation has caused a rise in domestic violence cases in some cities around the nation. Meanwhile, the number of domestic violence-related deaths in South Carolina has increased over the last decade. Joining us with more on what they're doing to help women in need is TOSHA Connors, CEO of My Sister's House. Good to see you again.
You too, Leah.
So I'm curious, over the last year, how things have been going.
They've been going as you would expect. It's been pretty severe, some of the cases that we've been seeing. We've been seeing a lot of clients coming in where they haven't had a lot of physical abuse previously, and now that lethality and that danger has just increased exponentially. So we've really had to pivot how we serve victims in the Lowcountry and meet them where they are.
And I want to learn more about how you have pivoted and how you do manage to reach out or have that accessibility for victims. But what has the impact on women been because of COVID and that isolation that I alluded to?
Sure, it's been pretty traumatic, right? You know, you've been stuck inside with your abuser, your boyfriend, your spouse, your wife, whomever, and you are thinking about the impacts that it has on the victim, but also on the children. The things that they've had to witness where they haven't had outlets to go, they haven't had school or church in a lot of instances, or really just even being with their friends. That goes for our victims too. We know that our victims typically are isolated from their family or friends, but sometimes you have a small support network. It could even just be going to work and having conversations with somebody outside of your house. And when you don't have those things anymore, it increases the isolation. It makes it even more difficult. And in that sense, we've seen a lot of clients reaching out to us for therapy services, recognizing that the stigma doesn't have to be there, it shouldn't be there, and that they need help and that we're available for them.
Yeah, absolutely. There should be no stigma in asking for help. And in that case, you said that you've been taking a lot of cases over the phone.
Absolutely.
And I would imagine that the phone was always there for potential clients of My Sister's House to reach out and speak to therapists, but it increased during this time.
That's right. So our crisis line is available 24 hours a day, and people can always reach out to us to safety plan. But when they were talking specifically with their therapist, typically we'd like to see people in person, right? It was just another touch point to give them some more physical contact with another person that was positive. In this instance, though, we have pivoted to offer more video services and phone services to clients, and we've seen that our clients have really been responding. They like it. They like the flexibility of being able to call in maybe from their car when they're dropping their kids off, and having those moments to be able to schedule things with somebody in a private manner.
Yeah, in a private manner. But why is it important to have a visual in association with the client and their complaints and their challenges?
So we know that not all abuse is physical, right? But sometimes we want to scan that person. We want to do a visual and check and see if there are any bruises. We also want to see, you know, is that person, does it look like he or she is eating? Are they well fed? Are they dressed nicely? Are they taking care of themselves? Are they bathing regularly? So sometimes those things can be indicators that something else is happening. It could be an indicator of somebody's mental health, right? If you start to see a steep decline. So we like having those visuals with people just to be able to check in.
How has the support been from the community, from the government to further your mission?
Sure. So there's been a lot of money that's obviously come down through the feds from COVID-related money, and we've been able to take advantage of that. So we've also had to transition a lot of our emergency sheltering services, using our actual shelter, but then also using different hotels throughout the service area. Again, it's really helpful for clients who don't have vehicles. Sometimes it's more difficult to get to one central location, but if we have different alternative sheltering units that are available that may be closer to somebody's home, or maybe in one instance they need to get out of that area. They get to go to a different part of the Lowcountry where they're not as familiar with. It can be a safer situation for them.
Yeah, and I think it's important for the audience to understand too is that it's under wraps where you're located, because the whole idea is to protect these victims.
Absolutely.
So you never know where these locations are for their protection.
That's right. We use several different locations. We will change them up frequently, and our clients know that they're confidential. So the same rules that would apply in our shelter also apply in these alternative sheltering units.
And for anyone who's interested in learning more about what you do at My Sister's House, you do have some town halls coming up. What are you planning on discussing during those?
That's a really great question. So we're going to be talking about breaking barriers. That's really been our theme this whole year. We've had a series on Facebook for the full year, and it's called Breaking the Silence. And this is really a continuation of that. So October is Domestic Violence Awareness Month. We typically have our Speak Up South Carolina campaign, and that's going to kick off with our virtual town hall event. So it's talking about breaking barriers for victims. So we have done a lot of polls, a lot of surveys with clients, with supporters to know what are the main barriers that they are facing and how can we address those. When we think about how we want to grow in the future, it can't be my sister's house telling clients this is what you need. We have to listen to the clients, to the victims, and try to really get them from victim to survivorhood.
Absolutely. 5 to Survive, it's your inaugural 5K. So when is this going to happen?
That's right. So that's going to be late October as well. We're really excited because typically this has been a walk a mile event, and we've transitioned it into a 5K event. There will be a memorial walk a mile at the beginning so we can honor the lives that have been lost. Unfortunately, this year in our community, it has been too many. So it's going to take on special meeting this year.
Absolutely, and people can sign up for that. You can also volunteer. So for more information, where should they go for that?
They should go to our website, mysistershouse.org.
Okay, fantastic. And 24-hour hotline, helpline,
Yes.
and this is 1-800-273-4673. We're going to put it up on the screen. Tasha, I want to thank you so much for joining us.
Thank you so much, Layla.
We're back after this.